Hello, listeners. This is Clarion speaking, your host for today's episode, which is a talk given by Saino Thomas. This talk is a part of the first virtual IC Nursing Innovator Forum meeting hosted on the topic Nursing Practice Trends and Innovation. Let us hear from Saino Thomas.
A very good afternoon to all the panelists here, to the chairman and to the organizing committee. Thank you so much for giving me this opportunity to be a part of it. I welcome all the participants who are hearing me in person as well as virtually. I would like to just take these next 15 minutes to share my thought in terms of how the experience of mentorship has been for me. You a thought that when the students are prepared to come on to the clinical setting, and the existing clinical people who are there already working, how can we make use of this mentorship? And if we are presently not looking at mentorship as an important element, let me start. This is a very beautiful picture which I always like. This is kite flying in the sky. So once a father was teaching his son how to fly kites in the sky, and then he was very expert around it and kept flying very high in the sky. After a while, the child said, it's really high, but if you cut it loose, I'm sure it will fly very higher than what it is already flying. And the father knew what will happen, but he thought, okay, let the child say, let's do it. And then what happened? He allowed the child to cut the thread. And the thread was cut and the kite flew definitely higher than what it was flying. But after a while, the kite started dropping down and, it came down to the ground. So then the father asked the son, what do you see? He said, oh, I thought probably cutting it would give it more wave, and it will go much higher into the sky. But it did not. It went down. It would have been better that it would have been tied. So that's what mentorship is all about. The thread which the kite is tied is the mentorship that we all get in our life. And then it's when we cut the connect between somebody who can help us to reach to that height, we really lose ourselves and come down to the floor. But this thread which is getting connected, if it remains there, it will help us to be more higher than where we are. So that's the gist of what mentorship is all about. Next slide, please. So in the gamut of mentorship, it is important that we look at a mindset and new results which come out of this. And when mentorship is there in picture, there are two different elements which are there. One is a person who would be the mentor, and there is a person who is a mentee. And most of us, when we move in from educational setting to a clinical setting, we become a mentee. So there would be questions in the minds of the new budding nurses. I learn a lot of things over here, but practically, is it different? Practically, definitely, there are a lot of things which are different, because the curriculum over which we learn teaches us how to become a very good clinical nurse, how to become a very good patient side nurse. But when we come down to a real working scenario, the organizations and the hospitals have a lot of other things. Apart from patient care, we are also looking at a lot of accreditations which happen either through bodies like NABH, JCI. So the functioning completely changes. We have to look at a lot of documentation, policies, procedures, and we have to look at the value of every organization is different. Today, every organization wants to have a culture of themselves, and as a brand, everybody will have their own values and philosophy with which they work, the mission with which everybody works. When you change one organization to another organization, our mindset has to accordingly tune to those culture and the mission and the vision of that organization. So how will that be bridged? So we see here that, we learn a lot of things from the education institution. A lot of theoretical knowledge is there. Okay. And in the land of clinical practice, we have to have these opportunities to implement those theory into practice. And the mentor over here is going to help us to bridge this. There's a huge gap and mentorship can bridge this up. So in clinical scenario, how things work. Okay. We see here that there are goals which have to be there for a mentor and a mentee. Now, a person who is going to be a mentor should validate the mentor's leadership skill, his own mentorship skills, whether they are good at it. So they come off with their experiences or with their knowledge background or with the education qualification that they gained with. Then they need to be recognized as an advisor. You need to have a senior person in the system who will be considered that they are expert in their area. And these are the guys who are preceptors. They are the ones who are certified. They are being tested that they are the good guys who are going to be able to efficiently mentor somebody. Thirdly, they need to be learning how to clearly communicate whatever is the real essence in which this particular buddy has to come up to on board. So that is important from a mentor point of view. It is also important to gain new perspectives. Now, nursing is not the same, which is around 20 years back or 10 years back, or, the millennials whom we are dealing with today. There is a lot of difference between the way people think. The culture has changed. It is a lot of tech-driven system today. So there is a lot of change and innovation which keeps on happening in all provisions. So it's very important that the mentor also understands the changes around what's happening in terms of the field, in terms of the philosophy, in terms of the technology, and brings in the new perspective from the mindset of the people whom they are mentoring. It also is important to give back and find new talents. Okay, so as we heard a lot about how pandemic has helped us to learn and evolve, it has given a lot of open-mindedness in terms of accepting freshers also in the system. So there's a lot of things which happen. Okay, now from a mentee point of view, now you start and you join an organization. So you are the one who's going to be getting, I'm the one who's going to be receiving it from a mentor. What am I supposed to be prepared with? Understand that we need to learn the workplace culture. As I mentioned earlier, every place have a culture of itself. What is the whole imbibed value system of that place? How does this place work? If you understand that, it will be very easy for you to amalgamate with that changing process. Accelerate the skill development. Accelerate means to speed up. Now, somebody can learn in 3 months, somebody can learn in 6 months, somebody can take 10 years also, and they will not pick it up. But it's very important. If you put conscious effort towards picking up those things, you will be able to. Because whatever we learn in 3 to 4 years is not just sufficient to have the skill competency needed to have a live patient and to manage around 6 to 7 patients with a lot of efficiencies in 8 to 10 hours of duration of a shift. So we will have to enhance and we will have to go on, incapacitating ourselves to ensure that we are doing skill development. Expand your professional network. Very, very, very important. I think a lot of organizations which have now come up specifically for nursing, groups which are, professionally connecting people. There are groups like Annie, there are groups like INS, there are more other people. Now the nurses are professionally connecting. This helps you to learn together. This helps you to have a knowledge sharing with each other and get those perspectives in place. So it's very important that you have professional networking very strongly built up. You can have it for your city, for your state, for your country, or even cardiology, then the cardiology network. These are examples. So you need to have expanding these professional networks. Transfer knowledge, whatever you are good at, make sure that you are making it as a point to expand your knowledge by giving it more. The more you give, it's a ripples effect. That's how it works. And get professionally. These are some basic goals which both the mentor and the mentee should have. So in that gamut of understanding, when we look at the aspect, why is it not? Yeah, could you enter one, please? Yeah. So what are the tools that nowadays you to map it up and to game it up? Number one is induction. As much as any good, strong, process-oriented hospital would be, they will have their process of induction. Induction would be a structured process where different topics are all finalized. Number of days will be fixed. In that area, a preceptor, a nurse educator who will handhold us in getting it inducted. Some inductions would only be theoretical, some inductions would be theory and practice, and some would be role-based. For an in-charge, for a supervisor, for a nursing head, inductions will vary. So inductions help us to get into this. So as soon as we go into a hospital, which is very structured, they will provide us processes with induction and they help us to get into the process fast. Second is competency mapping. Now, what is competency mapping? Every area of work, whether you work in an ICU, whether you work in a cardiac area, whether you work in a cath lab or an operation theater, or even in a ward, every nurse needs a specific competency required. Yeah. So these are tools which are there in most of the organizations to map. So there will be a self-assessment which you do to tell what exactly you are aware of. And then we also realize the gap which is there between what you know to what you need. And then those training needs are built up to build up this competency. Thirdly, there's something called credential and privileging. Okay. Now you may be working in a medical surgical area for 2 years. Now what do you want? You want to grow into an intensive care nurse. Intensive care is a different specialization, different skill altogether. Now there are no gamuts available that you go and become a good ICU nurse. There are programs which are there, but which also helps you to have practically without leaving a job, be in the same setting, work around in a mentorship, and then get privileged to work in an ICU. And then after professional observations and all, you become a level 1, level 2, level 3, and that's how you are upgraded into it, and these privileges get added. So these are some methodologies which are there to make sure that the organization helps you to make mentors and brings it up. And of course, a buddy system, somebody who is very strong, somebody who is very experienced, somebody who is very recognized by the system as a buddy will help you. There are some self-monitoring things also which you should keep in mind, which will ultimately help us to grow in both laterally and vertically. Self-monitoring, make sure that all of you are, even when you go and start working, learn all the diagnosis, whichever you are going to be commonly facing with. 2025 diagnosis will be very common. Make sure you're thorough around the pathophysiology and all the disease conditions around it. Make yourself thorough with all the medications that you use in the system. 20 to 25, 30 drugs will be there, which you commonly use in a particular area. Make sure you're thorough around it. Mentor yourself by knowing the investigations, the normal value around it, the value above it. When it goes beyond the range, what will you do during those situations? If you are doing this, you will be thorough and confident in facing all situations. Most importantly, have a very strong communication, and communication should be strengthened by using a very important tool called AIDET. AIDET. What is this? In your communication with the patient, acknowledge the patient, introduce yourself. Wherever there's a duration required with the right time, how much time the surgery will take, how much time the report is going to take and them to come. Have that in your conversation of discussions and explain. We learn a lot in our nursing education also. Explanation of procedures is very important. Explain everything so that you set expectation and patients will be ready to cooperate with you when expectations are set. Lastly, thank you. Thank them for using your services. Thank them for allowing you to help them in the path. Okay. This helps us a lot of growth, which is possible for us both laterally and vertically. Laterally, you can take up the role of that operations. You can become a CEO of an organization. There are so many nurses who have, who are excel to that extent. Customer care is an area. Guest relation is an area. Patient care experience and coordination is an area. You can look at industrial nursing, telemedicine, school. These are only few which I have listed. Apart from that, you can vertically grow in the same department as an in-charge, as a supervisor, as an assistant nursing superintendent, as a chief nursing officer, as an infection control nurse, as an educator, as a quality nurse, as a diabetic educator, and many more such roles which are evolving. Nurse practitioner is also a role which is now recognized by INC. You can do that. You can interpretive practice in anesthesia, in OT, okay, and in cardiology as well. These would be then helpful to have. And then whenever you go into the hospital setting, and what should you look forward from a mentor? They should be able to, you should always have that approach to help them in job orientation. They will help you in career transitions. They help you in enhancing the skills. Mentorship helps in professional and personal development. It also builds up the confidence, and it becomes a technical advisor, and it is also helping in correspondence, communications, which become very important in the initial and the crucial stage of life. Okay, with this, I would like to say some few strategies which can help, simple ones which could help us to be, mentoring and building up this mentoring relationship more stronger. The mentor and the mentee both should be committing to each other. Secondly, we need to develop trust. It's very important that people who are going to work together and mentor each other and the mentee should have developing a trust of relationship with each. Have your goals very clearly set, timely goals, a very structured understanding of what you will achieve within what time. Have your roles and responsibilities very clearly stated with each other, what is expected, what is not expected, and collaborate for results. Work together to make sure that everybody works towards and achieving this. Lastly, I would like to just conclude by putting a video over here that here, the famous personality over here did have the strength, did have the courage, did have the skills, okay? But only when a mentor came in the picture, she was able to use. Thank you so much. I think this is something which I wanted to put, that we may have all our skills, but if we have a right mentor, he will take us to those destinations which can work out for the best of us. And it will also help us to save our time to receive that. And there's no substitute for hard work. Thank you so much for giving me this opportunity. I hope I've done justice to the discussion which we had now. And I again thank the organizers for giving me this opportunity.
Thank you, Saino Thomas. To watch the complete club meeting on this topic, visit the link in the description below. Subscribe to the channel to get instant access to all the podcast episodes hosted by Innovation Curious. Follow us on social media through the links available in the description below. Thank you all for spending your time in listening to this week's podcast. Look out for a new episode every Wednesday, published on Google Podcast, Spotify, Apple Podcast, and YouTube. If you are interested in hosting your podcast with us, fill the form available in the description below. Thank you once again and see you next time.